we're seeing a substantial decline in life expectancy from 2019. So it's right about a 1 year decline in life expectancy. And while that doesn't sound like a whole lot at a population level, this is a huge decline, and it's not something that we've seen. I mean, you have to go back to World War II, 1940s, to find a decline like this in the past. I would say that the pandemic accounts for the vast majority of the decline. I mean, we are seeing increases in drug overdose deaths as well during the pandemic, and so that, of course, is a factor.
I think what is really quite striking in these numbers is that they only reflect the first half of the year, and it doesn't really reflect the full brunt of the pandemic. So I would expect that these numbers will only get worse as we do these analyses over time. Throughout the entire pandemic, what we have seen time and time again is that our Black, Latino, Indigenous populations have really borne the brunt of this pandemic. We see that they're at increased risk of exposure because they are oftentimes in frontline, front-facing work, oftentimes low-wage work without the additional resources to protect themselves. They're often living in environments where they're more likely to transmit the virus to others who live with them. They're oftentimes living in congregate living settings that put people at risk for higher transmission.
The racial inequities that we see in coronavirus are really characteristic of the racial inequities that we see in many diseases, be it cancer, heart disease, diabetes. The focus really needs to be broad spread on getting every American adequate care, and healthcare needs to be defined as prevention as well as treatment.